Hey everybody, it's Dr. Nicole from Healing Hands, and I have a question for you. The question is to mask or not to mask? All right, so we've been getting that question a lot lately in our office the last couple of weeks as the number of cases of coronavirus have been on the decline because of natural herd immunity. We are giving our patients the option to wear their mask while they get adjusted here in the office, and I'll share with you the science behind that and why we are giving our patients the option. But one thing I want you to know, and that's really important, some of you probably already know this already, is that that virus is so dang tiny that it will go right through the pores of all these homemade masks that you guys are wearing and that we're wearing as well. It's would be equivalent to putting a like a little ping pong ball through a big basketball hoop net, and that's the equivalence of this virus going through right through one of these pores in this homemade mask. So the U.S. Surgeon General also, over the last, I don't know, 2 or 3 or 4 weeks, time has been flying lately. I don't know about you guys, but I feel completely blindsided by this whole thing. The last 3 months are like a blur. I don't even know what happened these last 3 months, but the U.S. Surgeon General came out and said, well, maybe it's like really not a great idea that we are wearing these masks, and maybe these masks are actually doing more harm than good for a number of reasons. Number one, if the virus is getting right through it, then it's really not giving us a whole lot of protection. And so that gives us a false sense of security that we are being protected when really we're not. Secondly, if we're having exposure to the virus on our hands, even if we're wearing gloves, that virus is sticking to your gloves, and then you're constantly moving and adjusting the mask, that is actually increasing the number of times that you're having to put your hand by your face, by your nose, and your mouth. And so we already know, you guys already know, that that's the entrance, that's the portal of entry that the virus gets into the body, is the eyes, nose, and the mouth, right? So the other thing that I have noticed in practice is when the doctors were wearing them full time, especially myself, I was getting so tired and fatigued, and literally at the end of the day, my muscles were extremely achy and extremely sore, and I was wondering, well, why is that? And then it occurred to me that I'm not getting much air in and out. I'm not getting a whole lot of air in and out of this mask, and so it's creating what we call a hypoxic state in the body, which is not a healthy state. It's a decrease or a deprivation of oxygen, not only to the muscles of the body, creating that soreness and that achiness, but also to the brain. And we had a fascinating, about 4 weeks ago, we had something fascinating happen, which made me really question the use of these masks, at least for all the time. And that was, we had a patient who got adjusted. She was a pregnant woman. Yes, we do see lots of pregnant patients in our practice, by the way, but she was a pregnant woman. She had her mask on and she was getting adjusted, and when she got up off the adjusting table, she nearly passed out. And gosh, it made me so nervous. But it occurred to me, she was gasping for air, and it occurred to me that she wasn't able to breathe. Now here we have a pregnant woman whose body and whose baby's body now relies upon that oxygen to survive, and that oxygen is being depleted. So anytime we make any kind of decision in regards to our health or a medical decision, we always have to weigh the risk versus the benefit. So really, does the benefit of wearing the mask really at this stage in the game outweigh the risk? Now, I will share something else with you in practice that I just found out. I did have my antibodies tested, and I do not have the antibodies to the virus, and I was totally shocked. If I had to guess, I would have bet the ranch that I had them, and this is why I thought for sure I had the antibody buildup, and this is why. Way back in December, we had a whole family of patients who myself and their primary medical doctor are sure that they had the coronavirus. They were extremely sick. They experienced just about every symptom that patients with the confirmed coronavirus have experienced. And we were actually out of town at a conference, and I got a phone call from the patient's wife, and she said, Dr. Nicole, so-and-so wants to come and see you. He is extremely sick. He can't get out of bed. and you need to get on the phone with him. He needs to go to the emergency room, but he won't go. He's refusing to go. Can you please talk some sense into my husband? So I get on the phone, and man, he really did. He sounded really bad. He sounded really sick. And I said, look, you really, I'm not in town. I can't check you. I can't see you. I can't evaluate you. You really need to go to urgent care. You really need to get attention. You really don't sound good. And long story short, he did not go. He did not take my recommendation. When we got back into the office first thing Monday morning, I saw this patient. Now, by the time this patient came in, the wife and the 2 children were also by this time experiencing symptomatology. And this, of course, was prior to ever hearing the word coronavirus. This was before we even knew that this was a pandemic that was coming down the line. And of course, so we had no protective covering, we had no mask, and this family came into the office, and we took care of them, and we adjusted them. And we adjusted the dad, who was really, really sick, the mom and the 2 children. And for any of you who have been adjusted, you know that when you're getting an adjustment, man, you are really close. Like, I was really close face to face, within inches of this family's, face. They were breathing on me, they were coughing on me, and I never ended up getting sick. I never ended up getting the virus. And so they're actually having their antibodies. They just got their antibodies tested, and they're waiting for the results of that. But I think that that's a really fascinating thing, because, how is it that our office was open this entire time, and we literally see 80 or 90 or 100 people per day, like different people per day in our office that we're having this close contact with, and none of us ever got sick. And we have a large volume of patient population, and no one ever got sick. And we haven't had one patient that was actually confirmed corona. So I do believe that we have had patients that were exposed to the virus, but nobody that got significantly sick or died or anything like that. And so why is that? And so I think that's a really great question, because I think that what we do here in chiropractic, and what we do here in our office and offices all across the world in chiropractic offices, is really we help our body, the human body, to have its best and highest and greatest expression of itself. We allow the body, because we deal with the nervous system, so a lot of people think that we're back doctors, a lot of people think that we are bone, musculoskeletal doctors. We're not. We deal with the relationship of the nervous system to the spine, and then the relationship of the nervous system to all the organ systems and cells in the body. And people who are under regular chiropractic care do not get sick as often or as severe or as significantly as compared to people who are not under regular chiropractic care. So that's just a fascinating story. I just wanted to share with you what we have been seeing over the last 3 months here in the office in a clinical setting, and our experience that we've been going through with the virus. And I do believe that because this population of patients that we take care of, they have a certain mindset. You see on my shirt it says Mindset Master. They have a certain mindset that they live by, and that they and certain belief systems that they take care of their families by, that have allowed them to go through this whole pandemic and maintain healthy and strong through the whole thing. So anyway, just wanted to leave you guys with that thought. Hopefully the information that I gave you today was a blessing to you, and have a fantastic day.